Deciding between assisted living and in-home care is one of the most important choices many of us will face as we age. It's not just about where you live, but how you will live. And in today's video, we will explore the key factors that make each option different. And we're going to help you find the perfect fit for your lifestyle and needs. Remember, it isn't just a choice about care. It's about comfort, lifestyle, budget, and what suits you or your loved one's needs best. So let's talk about the basic differences to consider between assisted living and in-home care. But first, let's define both options. Very often, senior living options are all called assisted living, but there actually are many different levels and kinds of senior living options. Assisted living is designed for seniors who require assistance with daily activities, but they still desire a level of independence. These communities are going to offer things such as meal services and preparation, housekeeping, medication management, and 24-hour supervision. They're also going to provide social and recreational activities. However, assisted living communities are generally limited in what kind of medical care they can offer. In-home care is just like we would think. It is care that's offered to the senior in the care of their own home. It's going to be very personalized, and it's going to be tailored to the individual's needs. And that's going to range from basic help with daily tasks to more comprehensive medical care. So let's discuss what one should consider when deciding between assisted living and in-home care. We have the level of care. Assisted living is ideal if you or your loved one needs regular assistance with daily activities like bathing, dressing, and medication management, but they don't require intensive medical or nursing care. In-home care is suitable for varying levels of need, from occasional help with household chores to more extensive medical care. It's flexible and it can be tailored to the complex medical needs of someone. Then we're going to talk about socialization and activities. Assisted living provides more opportunities for social interaction, group activities, community engagement, those kind of things. And that can be very beneficial for seniors prone to loneliness and isolation. In-home care allows for staying in familiar surroundings, but opportunities for socialization might be limited. And it's going to depend a great deal on the individual's mobility and their social network. Then we have cost considerations. Assisted living typically is going to be a fixed cost every month. It's going to include housing, utilities, meals, care services. It can be more expensive, but it is predictable. In-home care costs vary depending on the level of care, the hours of service needed, and it can be very affordable for those needing less intensive care, particularly if there is help from family and friends. Now, if you need help finding an assisted living community for yourself or a loved one, or you would like to be connected with a real estate agent in your area who knows how to deal with the concerns of seniors, check out the link pinned in the comment below, and we can set up a time to have a one-on-one call. Now, let's talk about familiar environment. Assisted living involves moving to a new environment, and this can be very challenging for some seniors. In-home care, they're going to stay in their own home, which can be comforting and beneficial for their emotional well-being. If you've seen any of our other videos, you know we have talked about the importance of having conversations to determine the needs of your senior. The fact is, there will be consequences from all of these decisions. So let's talk a little more in depth on how we might determine whether familiar settings outweigh the social aspects of assisted living. There is a built-in social environment in assisted living communities that might not be available or robust in the at-home setting. Regularly scheduled activities, communal dining areas, shared spaces, those encourage interaction and they foster a sense of well-being. This is a built-in network and it can be crucial for mental health. It's going to help prevent feelings of loneliness and isolation, which are common concerns as one ages. The National Institute of Aging says loneliness and isolation are associated with heart disease, depression, and cognitive decline. But while the social benefits of assisted living are significant, the transition to an assisted living community can be emotionally challenging for some seniors, especially in the beginning. Leaving a long-time home and adjusting to a new environment, it's going to require a period of adaptation, and it can evoke lots of feelings of loss and grief. In both situations, it's essential to consider how each option affects not just the physical care needs, but also the emotional and psychological health of the individual. A supportive social environment, whether in a community setting or through tailored activities and visits in a home setting, play a vital role in the overall well-being of a senior. This aspect of senior health is sometimes undervalued in the decision-making process, but it is crucial for long-term happiness and quality of life. Then we have independence and privacy. Assisted living offers a balance of independence with the assurance of available help. However, in a community, there's going to be less privacy. In-home care is going to maximize independence and privacy in one's own home, and the care is going to be tailored to the individual's schedule and preferences. So that's going to be maximum privacy and independence there. Then you have family involvement and support. Assisted living can be a really great option if family members are unable to provide the necessary level of care or supervision or help in finding the people that come in. In-home care is ideal if family members want to be involved in the daily care and decision-making process, or, if they're able to. Sometimes it's not always feasible. Then we're going to have health and mobility issues. Assisted living is sometimes better suited for those with mobility issues or cognitive decline or impairments. These communities are designed for accessibility and safety, and the staff is trained to deal with these issues. In-home care can be adapted to suit the specific health needs of the individual, including specialized medical care. Even very specialized, very complex care. However, some of those changes might require significant alterations to the home to increase safety or to accommodate things like mobility devices. Ultimately, the decision is going to depend on personal preference, specific care needs, financial considerations, and the desired lifestyle you're looking for. It's important to discuss these things with the family member as well as all the family members who are going to be involved with possible health care. It also might be wise to reach out to healthcare providers so you can make an informed decision that best suits you or your loved one's needs. So if you need to be connected with a real estate agent in your area who's familiar with senior issues, or you need help finding a senior living community in your area, check out our link in the comment below. And if you've been struggling with this decision between in-home care and assisted living, we would love to hear from you in the comments. Tell us what you think is important and what you've learned. If you'd like more information on other senior housing topics, check out our other videos and playlists. My name is Melissa Halter. Thank you for watching.